Or we'll record it. All right. So again, for those just joining us on the recording, this is Trauma 101, exploring trauma-informed strategies to support students' mental health needs. My name is Roberta Miranda-Alfonzo. All right. So again, we are scheduled from 8 to 11, and we'll have our breaks as we just talked about. And as Mr. Corbett was talking about, he mentioned to you a little bit about the practice. And the practice, we're here at the UNLV campus. We also have a new satellite clinic, which we're very excited about because it is youth oriented for our little ones and for our teenagers. And as we were mentioning that UNLV trains master's level clinical mental health students, clinical psychology, doctoral students, school psychology, master's and doctoral students, and postdoc psychology fellows. So we are an interdisciplinary training center that allows our advanced students to practice clinical services under supervision. So I serve as one of the clinical supervisors, as well as just some of my colleagues. So we actually co-facilitate the groups with the students. We review recordings of their sessions, and we give them some feedback to really provide them with the most thorough training. And if you're curious as to what the practice acronym is, this is it. And I still don't have this memorized, and I should. It's the Partnership for Research, Assessment, Counseling, Therapy, and Innovative Clinical Education. And you'll see a couple of photos there that represent each of our campuses. You'll notice like the rainbow, the sunroom, and all are welcome here reflect our new satellite clinic. We really have strived to make it very youth focused and inviting and warm. It's only been open for a couple of months. In fact, we're having our grand opening in October, and just again, very excited to be able to expand our youth services. So just a little bit about me, so you know who's going to be speaking with you for the next 3 hours. Again, I serve as a youth coordinator and clinical supervisor at that new satellite clinic. As far as trauma experience, I am trained in trauma-focused CBT, clinical behavioral therapy, and have also been a practicing and licensed clinician. Gosh, I don't know, we'll say 2005, 2000. Something in that area. Specifically, I've been working with adolescents for over 10 years, so I do have some experience working with teenagers. I also do have some experience working as an educator, as a college instructor. So, you know, as far as classroom management, even though ages are a little bit different, it can identify a little bit with how to manage a classroom setting, just with some older students. And then as far as just background, my master's is in counseling, and actually just graduated now it's in June, from Oregon State University, which is a hybrid program with a PhD in counseling. So that's a picture of me and my son just a couple of months ago. So very excited to have reached that, that end mark. On a personal level, I love traveling, live music, and theater. In fact, I was just in Ely, Nevada over the summer and just loved it very much. So as far as learning objectives, this is what the plan of attack is for today. So I'm trying to break it down in pretty much 3 segments that coincide with just some sections, and then we'll take a break and then get to the next section. So we're going to spend the first hour talking about common trauma responses in children, the terminology of trauma, and just maybe some of the stigma around it, and trying to maybe decrease some of the feelings of stigma around trauma. We're going to talk about the idea of trauma-informed care. And then the second and third are really going to talk about how to create an emotional corrective classroom, strategies that hopefully you can apply in all grade levels. And then also, and wrapping up by talking about what you can do as an individual to practice self-care and manage through some of these areas that can be a little bit difficult at times. So that importance and some ideas to help maintain your own health and well-being. So just as we start to segue into the area of trauma, the thought is like, why have this training? Why discuss trauma? A lot of us might think like, well, if it's trauma, it's out of my scope. I'd rather refer out. And even though that's there's certain you know, legitimate thoughts behind that. We're trying to strive away from the idea of only mental health providers can talk about trauma with our youth and our young adults. Especially with the idea that mental health access is really quite limited. As much as we are very happy to be a partner and offer those CIS services, we recognize that, especially out in some of our rural areas, that mental health providers are pretty limited. And so in that, we want to do what we can as a community to try to see what we can do within our scope to be able to attend to some of these potential problematic areas with some of our young adults and youth. So in that, I'm hoping, my goal is by the end of the workshop today, that we try to remove some of that stigma associated with the terms pertaining to trauma, that we don't necessarily shy away from it, that we learn to have conversations around it, that we recognize that we can do something about it. We'll talk about strategies and just to kind of give you a preview of what's ahead. Sometimes just sitting with a student and not saying anything, just being present, that can help alleviate some of those feelings that that child might be going through, or feeling heard, or just connecting with the student can help address some of these symptoms or some of the symptomology related to what they might be going through. Recognizing that trauma doesn't have to be this one big thing like a car accident or a fire, but there's these what we'll call little T's that we might be able to tackle and address at all levels. Trauma is also, hopefully our goal today too, is just to increase awareness, not only among you, but maybe among your colleagues, among the students themselves. So having conversations about trauma in the classroom, talking about stress, talking about coping mechanisms, maybe even incorporating it, as part of your exercises, to practice a moment of deep breathing as we get started, or just taking a moment of just connection with the classroom. So maybe just a couple of little things that can be sprinkled, into all the hard work you're already doing. And also maybe opportunities to educate families as well. Hopefully this is to help encourage, just like there's so many of you today, and this is already indicative that you're already adhering to this, the idea of a trauma-informed culture. So then you're all knowledgeable in this area, and you have a heightened sensitivity to it, or will, especially after today. And then hopefully by being able to implement some of these strategies, that it'll help facilitate a more supportive and calmer, more enjoyable classroom and school experience for you and for the students. So that is part of my goal today. So when we think about trauma, there's unfortunately, there's some very high numbers related to children impacted. So this is not one or two students in the corner of the class. Approximately 2/3 of children in the United States experience a trauma before their 18th birthday. 2 out of 3. So unfortunately, we see that this is more common than not. More so, approximately 1/3 of children experience 2 or more types of trauma. And then rates are even higher for our students of color. So let's talk about common trauma responses in children. And I know that many of you are already trained in this and have had exposure in your education. And so a lot of this might be a review. But as we transition back into the school year, it might just be a nice refresher, for all of us, me included, as I get prepped for the new fall semester. So what are some common trauma responses in children? Well, this may not be surprising for you. I'll kind of review it, maybe think a little bit about some of those children that you've seen in your class, whether they're first graders or 11th graders. We might see regressive behaviors, so maybe children regressing to younger behaviors, or maybe, just not kind of catching up with their peers. We might see some anger and aggression. We might also see avoidance and social withdrawal. So we start to see a little bit more isolation. And we certainly might see that a little bit more. You probably already saw this last year and then this year because of the pandemic. A lot of students have been spending a lot of their time isolated. And with that, it's now a little bit even more uncomfortable and more awkward to integrate and socialize with peers. Sometimes we see that inability to concentrate. We'll talk a little bit more about that. Depression and irritability. It's, as a counselor, when we assess for depression in little ones, it's not oftentimes the overwhelming sadness that's the presenting, that's presenting in the child. Oftentimes it's that irritability, that crankiness, that they get angered a little easier. That's oftentimes a clue to us that there might be some depression present. We might see some children that worry a lot, become very fearful. What's also very common is our children who have physical complaints. So they want to see the school nurse. They have their tummy aches, their headaches, this hurts, because, sometimes they don't have the language to really express what else might be going on. And sometimes their body is telling them that there might not be emotionally, that there might be something emotionally going on. So sometimes it's those physical symptoms that children do experience. So being mindful that sometimes, not always, there's always exceptions to the rule, that when students, complain about tummy aches or bathroom issues or things like that, that might just be a little red flag for you to just keep an eye on, and self-blame. But a caveat, we just also want to remember that not all children who experience a traumatic event will develop a traumatic response. So we might have children in our class that have and are continue to be exposed to trauma, but may not show any of these types of responses. So just, sometimes the loudest students kind of get the most attention. We might think that the aggressive student is the one that we need to really zero in on, when sometimes it's in the quieter students that we also might to just check in with on occasion. So that's a list of pretty evident and common trauma symptoms. But let's also think about just students, like thinking about like envisioning your future class, or your previous classes, and what has transpired among the different students, the personalities, the synergy, in the class. So how might those symptoms translate to the classroom? Might show up as one of these types of behaviors. Maybe we see that separation anxiety. So if you're working with maybe younger students and you're seeing that there's maybe a lot of crying at the drop-off, that they don't want to go to school, they don't want to let go of their parents. Again, doesn't automatically mean trauma. It's just something to just monitor, to say, I'm wondering if there's that child is feeling some sort of, I've been exposed to some sort of trauma, perhaps at school with a potential bully, something else that's going on at home that makes that child anxious. So it's just could be indicative. Another thing to think about, which we don't always really hone in on, is the student that maybe is not eating. So doing what we can to maybe monitor the cafeteria. So if we're on lunch duty and we're seeing that there's a student that just throws away their brown bag lunch all the time, or they get the cafeteria food and then they just pick in at their food, that could be a symptom that there might be something going on. Not engaging in classroom activities, either with you or with their peers. Again, just disengaged. maybe students, younger ones that might have accidents or have to run to the restroom. Those somatic symptoms that we talked about. Maybe even those students that get easily startled. So door slams or book drops. And we kind of you see that student that's just very highly sensitive to their surroundings. So as you can see, as you look around your classroom, that it may not be the loudest student, that might need that extra attention, but it's keeping an eye on all the students, and the behaviors to just, become what we call kind of attuned, to what might be going on. I know there's a lot of information. Some other trauma responses that we might see. We might see as children who fight, believe it or not, daydreaming. So just checking out. Of course, we have our creative, our just a very imaginative students as well too. But sometimes daydreaming can be an indicative of disassociation. Like I am just like trying to get out of the situation by tuning out, to putting my attention somewhere else. And that ties into that inattentiveness, perhaps sexualized behaviors that you've recognized, restlessness, impulsivity can be also another indicator. So a student who maybe get out of their chair, or you have an assigned activity and they want to do this, or they blurt out answers. And part of that really has to do with brain development, because what we'll talk about is that children who've been exposed to trauma, sometimes it impairs certain areas of that brain development, which one of the effects of that is that impulsivity. So we see that children not able to have that emotional regulation like maybe some of their peers do, because their brain development hasn't allowed them, hasn't maybe caught up with them to do that. So that's why part of the reason. So part of it is that they're not purposely just like trying to be annoying perhaps, but it's part of just that emotional regulation that hasn't been acquired yet. Sometimes not speaking, and just sometimes refusal to do things. So as mentioned on the bottom, oops, let me move my screen, that sometimes trauma responses can be confused as negative, externalizing behaviors. So it's sometimes easier to overlook some of the quieter responses. Oops, what did I do? So as we talk a little bit about terminology, I imagine if I, had said, oh, if you were to think of a trauma, what comes to mind? And it's true. Trauma is a reaction to a deeply disturbing, life-threatening event or situation. So certainly we think of the natural disasters or violent crimes or a school shooting or a serious car accident. Those are what we would consider big T traumas, pretty traumatic. Chronic big T trauma is a result of repeated ongoing trauma, such as abuse or sexual abuse or domestic violence. But we have this terminology in the field that we refer to as like big T and little t trauma, and not to minimize little t trauma at all. But just to give, just a little distinction to each of them. So big T, again, the bigger accidents, bigger, pretty life-threatening events. Little t's, as we'll talk about, comprise of those little exposures on a regular basis that could still result in the same type of physiology, same type of emotional reaction, and some of that symptomology and behavior symptomology we talked about. And just to clarify, we often hear the term PTSD thrown around, post-traumatic stress disorder. And just to give it a little distinction, for a client to have met, or student to have met the criteria for PTSD, that a certain list of symptoms that we use with our DSM-5 criteria do need to last more than a month, and does need to be severe enough to interfere with daily functioning. So I won't go in that list, but I just want to be cautious because I know sometimes we'll throw that term around and say, oh, I have PTSD, from that, from that coffee I drank, or I have PTSD, or I think they have PTSD. And just to be mindful that we do want to make sure that, we don't categorize or minimize like the label, I don't say the label, the diagnosis of PTSD. So what about little t's? Well, again, thinking about trauma, that it certainly it's a violation of sense and safety and security that interrupts a child's safe haven. So sometimes I kind of like, I envision it like, what does that safe haven might look like for a child or young adult, even for us, honestly. What might that safe haven look like or feel like? And then what would that experience be like if there was a violation of that sense and safety related to that safe haven? So those little t's really do include events or ongoing situations, or even a combination of compounding situations that causes distress, fear, and primarily a sense of helplessness. So maybe for our teenagers, those little t traumas might be as a result of a romantic breakup. Think of our teenagers. It's like when they have a breakup, it's devastating. All of a sudden there's low self-esteem perhaps associated. There's rejection. There's, I don't even want to go to school the next day. I mean, it's legitimate. I mean, those are some of those feelings of distress and fear and helplessness that might transpire from a breakup. So it's really important for us to honor that, rather than, lean towards the idea of like, oh, you'll get over it, or it's okay. There's more people out there that you'll meet. This is an opportunity to actually sit with the student and just let them grieve, let them have that experience, give them validation that it's okay to feel a little or sad or upset over a breakup. Bullying, I mean, especially if it happens on a regular basis, because that's also a sense of helplessness, stress, fear that could even like impact a student wanting to go to school. Maybe feeling anxious that they're going to see that bully when they go to their next period or their next class. So knots in their stomach, that they might be experiencing. Financial distress. So if we happen to notice students, that maybe are wearing the same clothes every day, or they just don't have the supplies, that could lead to feelings of maybe feeling like an outcast, or there's indicative of stress going on at home. Maybe, feeling not inclusive in events, that could lead up to these little t's. Microaggressions. This is big, so if we have clients maybe picked on for their cultural backgrounds or for their sexual orientation, or if they are in a lower level class than their peers and they get picked on, those microaggressions can also constitute trauma, or what we call little t. And the reason I'm spending so much time on that is this is teenage life. Oftentimes we're probably going to see that a lot of our young adults do experience those little t's. And if there's not some built-in resiliency, or if it's a combination of compounding situations, that these ongoing continual types of big T's and or little t's can induce changes to the brain that can result in varying degrees of cognitive impairment and that emotional dysregulation. So it causes limit or some delays in that brain development, which is where we see maybe some learning difficulties, that difficult to stay focused, maybe some indicators of ADHD, some speech development issues, social skills, sleep impact, and of course, if we see some sleep impact, it becomes cyclical. They're not getting enough sleep, then they're not focused, and it just affects emotional wellness. So those little small T's are really, they're events that exceed our students' capacity to cope and cause a disruption in emotional functioning. So the stressing events are not inherently bad or necessarily bodily, integrity threatening, but it really is described as ego threatening due to our students feeling notably helpless, shame, sometimes humiliated. They just feel like I'm not good enough, and sometimes, this is where there's that opportunity for intervention. So when we see students exposed to these little T's, their ego is really hurting. They're feeling maybe a little bit of shame. They're feeling maybe some self-blame. They're feeling like maybe little, and this is just an opportunity for one of us as an adult to look at them in the eye, to check in with students, to smile at them, to give them some looks of reassurance. And that can make the biggest difference when it comes to these students who might be experiencing this. We also want to take into account the idea of COVID-19. And I didn't want to relay all of this data, but in fact, here's a resource for it, but I'm just going to zoom over on my screen briefly so you can just take a look at this resource from the CDC. And this was dated March of this year. That new CDC data illuminates youth mental health threats during the COVID-19 pandemic. So this is based on a survey of high school students during the pandemic that can maybe inform programming. So when I mention the idea of a trauma-informed culture, it doesn't necessarily mean, well, let's hire a mental health counselor and put them on the staff. It might mean like incorporating after school projects or social peer opportunities, or having conversations, or putting posters in the hallways to just talk about it's okay to not be okay. Because with COVID-19, we're seeing that the numbers are pretty prevalent as far as mental health struggles. We can just see here, I'll just read a couple of these stats, that more than half of the students reported emotional abuse by a parent or other adult at home. So with the pandemic, we see stress levels heightened with family. Maybe we've seen family members, as we could see here, losing their job or working from home, or just a decrease in finances, which results, of course, to stress, which results to probably not a great communication in the household. We also see that school connectedness, that wasn't really, being able to be facilitated. So when the students were isolated at home, it really did increase persistent feelings of sadness or hopelessness. And even suicidal ideation increased, quite a bit during this time, because there was part of that was connected to that lack of social connectedness. So school is important to fill in this gap. So as we're thinking about programming, and we're thinking about bringing some of these students back who may be having some of these feelings, is what can I do to promote engagement? What can I do to maybe an icebreaker activity that just gets the students to get to know each other a little bit better, helping them feel a little less awkward coming back into the classroom? Or what can I do to maybe recognize that their focus isn't quite there yet, that part of that, and maybe I can promote that little bit of connection and acclimate, then they're going to be ready for some of that learning and some of that the curriculum that I'm responsible for. So these are just some things to potentially think about, recognizing, just putting a spotlight on our kids and ourselves, that our students coming back, that's the last couple of years have been particularly difficult, because they've relied so much on that social connection, and there's been a lack of it. For the most part, having to sit in computers and smartphones for some time. has had an impact on their attention spans, ability. So thinking about what can I do to promote that connectedness. So do a little bit more, then we'll take our first break. So thinking about what is, oops, I want my current slide. There we go. So then what is like the idea of trauma-informed care? And I'm a mental health therapist, and I've heard this term kind of thrown around a little bit. And honestly, I wasn't even sure what it meant till just really, within the last year or two. And because I was a little intimidated by it myself, I'm thinking, gosh, is this kind of delegated to emergency rooms? Do I have to have all this specialty training under my belt to be trauma informed? So the term was definitely, even for me, intimidating. But come to realize what trauma informed care is kind of like what it is, just knowing what trauma is and a heightened awareness. And in that, hopefully creating a shift in perspective. So with trauma informed, it provides an empathy. It provides maybe a kind of an understanding that one of our students might be going through something. And this is potentially the reason why they might be reacting in a certain way. So shifting from what is wrong with this student? Why is the student acting out? Or why is the student always causing problems? And having kind of a negative perspective on students and shifting that to like, what has potentially happened to the student that has led to this behavior? What might be going on at home, that is now translating into the classroom? What kind of hurt has this student gone through? So being able to tap into a little bit more of that deeper understanding, that's a trauma-informed culture, to convey, communicate, understanding, empathy, and patience. A lot of patience, and just recognizing, this is not necessarily the easiest classroom to maintain when this is happening. Instead of though focusing on, this person, they're acting this way and they're acting this way. It's like, wow, what might be going on? What is the classroom bringing in? What are each of these students bringing in that could resemble hurt or humiliation or shame? And now it's kind of transpiring to these types of symptoms or behaviors. So recognizing the presence of those symptoms and acknowledging the role those big T's or little T's might be playing in their lives. Knowing and understanding how trauma can be treated. We'll talk about that a little later. With sneak peek, we can talk a little bit about how trauma can be intervened even at this level. And then recognizing if it can't be, to whom I might need to refer them to, and what does that look like? Hopefully trauma informed by having these types of workshops changes organizational culture to emphasize respecting and appropriately for the effects of trauma at all levels, to recognize that it's not just the major events that we need to pay more attention to, it's the little ones. And with the organizational culture, checking in with each other, because we're not able to be present to recognize potential trauma in our students when we ourselves are going through a lot in our lives. So that's why as therapists, we're encouraged to seek therapy ourselves, to have supervision, to have consultation, to check ourselves, and to make sure that we can provide and give and teach and to be present. And also trauma-informed culture actively avoids re-traumatization. So if we have a tendency to yell when we want to manage our classrooms, we want to make sure, like, okay, is that trauma informed? Am I noticing that students are maybe becoming visibly shaky after I yell to bring down the classroom, or I slam the door to get attention? Am I noticing that that high sensitivity? So I really want to do my best to kind of manage any sort of, avoiding re-traumatization, and instead create safe and secure spaces. And we're going to talk about ideas for that in the later part of the presentation. So just a quick exercise, because you've heard me talk for 40 minutes straight, and I appreciate that. But I want to take just a moment before we do our first break and do just like a quick reflective exercise. And I know normally I would have everybody kind of use the chat box to kind of relay their answers, but in this instance, we'll just kind of sit and think to ourselves for a moment. And to really, when we think about who was one of our favorite teachers, so just to maybe think back, maybe, go back to kindergarten, do a mental scan and try to identify, for the purpose of this exercise, just one teacher who you'd say was one of your favorites. Could be high school, could be college. And when you think about that teacher, to think about what were their characteristics and what was your feeling around them? Like, what experiences did you have with this teacher when you think about them? Maybe what did this teacher do to make you laugh or make you feel safe or just really stood out? So I just want to take a minute just to actually sit with this for a moment. I'm going to practice it too. It's funny because we'll probably like, oh yeah, I remember Miss Rivas, or I remember Mrs. Pierce. Oh, but Mr. Douglas, I remember what he did, why he stood out to me. And so as we think about them, and I'll share with you one of my favorite teachers, and it was in 5th grade. And yeah, his name was Mr. Douglas. And Mr. Douglas I went to a small school in elementary school. I went to the same school from kindergarten to 8th grade. So same school for 9 years. And each grade only had 2 grades, 2 classes. So there were always like 50 to 60 students each grade. So relatively smaller school. And Dr. Douglas was one of the very few male teachers we had at the time. Tall, broad. But when some of his characteristics around him was that he was so funny. And with me specifically, he would take the time to let me know, to share with me my strengths. Yeah, he would give me affirmations. He would let me feel heard. Like he recognized me. Like I was a shy, Mexican, just kind of really stayed myself. I wasn't used to, these big broad men. And so when he'd take me aside and say, you know what, you're one of the top writers in my class. Or at open house, he told my mom all these wonderful things about me. And I was just beaming. I just remember that I felt he recognized me. I felt like he saw me. He pointed out strengths I didn't even know I had. And I felt around him, I felt so positive. I felt confident. I felt like he saw me. And so I think about that today. I'm thinking, how as a teacher can I translate some of those characteristics to the students I meet, even if they're college students? And I strive to do that. I strive to stay after class and talk to them. I strive to have personal meetings with students. I use affirmations in my feedback with them, personalized affirmations. I relay strengths in them that I see in them. And my goal is to perpetuate this feeling with my students. So thinking about maybe your teacher was just specifically funny or creative and it made you feel safe and it gave you a break from the seriousness of life, whatever that is, I encourage you to take some of those characteristics and sprinkle them, you probably already do, into your practice, because that can make a huge, huge impression. I mean, I'm thinking, gosh, I'm almost 50 years old. I'm thinking of that experience in the 5th grade, and I can still remember it to this day. So you just never know how this is going to impact you as an individual and your students. So thinking about that as being one of those teachers of influence is to be able to tap into your empathy, express interest just by noticing them, helping your students feel less invisible. So it doesn't take a mental health degree to do that. It just says like, hey, hi, how you doing? Just giving attention. Being a source of resiliency, so modeling resiliency. If your students do reach out to you, helping them find resources. Avoid putting pressure on yourself. Sometimes when I see educators, they worry, like, what if I don't say the right thing? What if I say something and it's going to cause more harm than good? You know, and I always say, don't. It's not about putting pressure on yourself. It's more about being present and authentic. If you're present and authentic and come from a kind perspective, the natural things will come. The natural words will come out. And sometimes it's rarely anything we say. It's how we have that experience and connection with the students. Also, just be okay to lean on other helpers. So if it's a little bit out of your scope to say, oh my gosh, I'm not sure what to do here, is to use each other as resources, to know what resources are in your community, maybe even on a remote basis, like to say, oh, I remember UNLV, they offer therapy, and maybe I can hook them up with CIS, or maybe I can connect them with the Boys and Girls Club. So being kind of familiar with what might be out there beforehand. So you have like maybe a little list of resources to help you out. And then just remembering more than anything that one adult can make a difference. So when we're working with hurt children and they maybe feel invisible, like I mentioned, just that eye contact, because I didn't reveal earlier, I came from a lot of it wasn't an easy household that I was coming from. There was a lot of conflict. There was just a lot of not so good things going on. So to be recognized by Mr. Douglas still brings me recognition and appreciation to this day. So let's do this. Let's take a break. I'll stop my screen for a moment if I can find it. There we go. Boop. So perfect timing. So let's take a break. We'll come back at 9. And then we'll start with a brief video, and then we'll jump into how can we manage our, maybe incorporate, actually, we're going to go over the pillars of trauma-informed care. So thank you for paying attention, and I'll see you back here at 9. Resume recording. All right. And so as to kind of wrap up what we were talking about, I'd like to show, it's a very brief video, 3-4 minutes at most, of a Brene Brown video. And many of you probably have already seen this one, and I could watch it over and over, just love it. And it's about empathy. Because one of the things that I had mentioned is by tapping into our own empathy, perhaps to connect with some of our students, and it's a little different from sympathy. So, so she describes a little bit of that, and then we'll have just a quick chat right afterwards. So let me see if I can share my screen, and I will put my volume up. I'm going to put my volume up high on my side, and hopefully that helps with on your end. Okay, so share. There it is. I can hear. All right. If it's too loud, let me know. Oops. Oops. I forgot to share my volume. 1 second. Share screen and then share sound. There we go. Hopefully that works now. Can you hear it?
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy.
Just wanted to check in. Can you hear it okay?
Yes, we can hear you.
Okay, thank you.
It's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Oh, it's loud. Oops, 1 second. Let me stop it. Okay. You stop this before another one stops. Okay, I think we should be okay. Just didn't want another video to start on us. So yeah, it's a short but poignant video. It was just that talks a little bit about empathy, and again, kind of revisiting that point that it's oftentimes, not necessarily what we say or say the right words, but it's, oftentimes it's the feeling or the experience that we can create with our students and with others. So taking that pressure off of us. And it also ties into the idea of practicing empathy rather than sympathy. because sometimes we can relate sympathy to the idea of like, I feel bad for that student, or I feel sorry that they don't have the resources, or I'm sad for them. And, you know, we're going to have emotional reactions. We're going to experience certainly, you know, some sad feelings that could be associated with students' backgrounds. However, when we lean too much, though, on the sympathy, it's there's it creates a little bit more of a burden on us personally, because it's like now we're feeling sad. We're just imagining the worst for this for the student, when instead we can really maybe focus on their resiliency or their strengths of what they are able to do despite these circumstances. And honestly, that's really what helped me work through those 9 years I worked with adolescents, mostly referred through the criminal justice system, many from marginalized backgrounds. So coming in with very little resources, very little parental support at times, just very little hope at times, and being able to sit with them and just, even though their circumstances are pretty dire, I would really strive to look for something, you know, within myself, you know, or something within them I could recognize to say, despite all these setbacks, look at them here. They're still here. They are an amazing artist. They still have such a presence about them, you know, that's so engaging. They're very charismatic. They are so resourceful, you know, and so when I would believe in these things, it would be conveyed unconsciously. So whether it was, or I could say consciously or explicitly, sometimes I would relay these strengths I'd see in them, or I would think them, and then my reaction to them was more strength-based, you know, versus, gosh, poor Joe here. He never has the worst luck. You know, if I was leaning towards that, it would be harder to instill hope in the clients than tapping into the empathy. What are the circumstances that led Joey to this experience, maybe to criminal behavior, and or what kind of hope can we still instill in the situation and in him? So that's where I love that video, because it's so inspiring. I could watch it just over and over. It's so inspirational, just to remind us, you know, that it's just connection that can make a big difference. All right, so I'm going to get back to my screen here. If I can minimize this, sometimes there we go. It's a little tricky with the screens. All right, so so that was Brene Brown, and I love a lot of her other work as well. If you haven't had a chance to see her videos or her, because things in the way. All right, slideshow. For current site. There we go. Awesome video. So as we wrap up this segment, it's, you know, again, that role of emotional attunement is the term, is being present and aware of your students' emotional needs. Even that awareness and that presence can be key in this. And think that children, sometimes they are wired to act before they think. So sometimes, especially developmental wise, to see those, try to hopefully, it's not always easy. I mean, if you have especially 3, 4, 5 children who are being very active in your class, it's sometimes hard to manage. But recognizing that sometimes developmentally that there's this tendency to act before thinking things out, especially dependent on their age. That hopefully by creating a psychologically safe classroom can help actually bring back that attention, bring back that engagement, hopefully bring a certain calmness and organization to the class, which will hopefully make it more enjoyable for you and for the other students. So let's see what that looks like. So we're going to spend the next segment, just it's terminology, so then you're really now informed of what trauma-informed care is. And the trauma-informed theory, or the framework, involves these different pillars, 1, 2, 3, 4, 5, 6 pillars, which we'll just go over each specifically. But this gives you like a framework of that model of when we think about trauma-informed care, we think about, okay, this is the framework, but specifically, how can I create this in my classroom or in my school? So we'll just take each pillar one by one. And then hopefully, this is my goal for you, is to maybe even hopefully take away one idea for as you set up your classrooms, perhaps for the new school year, that could promote this idea of a trauma-informed culture. So think of safety. So one of the pillars in trauma-informed care is the idea of creating a space for students that feels both physically and emotionally safe. And so what does that look like? Well, we can do that first with ourselves. So this is where we ourselves are modeling respect, kindness, responsibility, and promoting that starts to create a comfortable and calming space. We'll talk a little bit about how that consistency can sometimes create that safety. So perhaps, the idea of starting class, with a certain activity or some sort of maybe an opener, like we start every class with a deep breath, for example, or we wrap up the class with a deep breath. So the child has some sort of idea like what to expect in that classroom experience. And this is something I've had to learn, because I was thinking as a college instructor that I had to make each and every class unique and different. And teaching counseling classes, I would sometimes surprise them to say, surprise, today we're going to practice counseling skills. And over the years, I noticed discomfort. I noticed the size of, I've noticed just some pushback, and then I kind of question, like, I would think that they would like the spontaneity, but come to find students didn't. They liked to know what to expect coming in. They liked knowing on the syllabus, when I walk in the classroom, emotional wise, safety wise, for the most part, what can I expect? And so that's where setting up the agenda, the framework, can really help with that safety. Also, too, we can also talk about maybe feeling charts. So sometimes, like there's some websites where you can print out, little feeling charts that might say, how do we feel today? Sad, happy, and sometimes they're cartoons or Disney images, things like that. We want to perhaps maybe invest in a couple of books that promote social emotional literature. So if you happen to have like a little bookshelf, maybe bring in books that attend to anxiety or mental health or age appropriate, so that kids know it's okay, or there's terminology, or you mean other kids feel this too. So maybe a check-in and a check-out with students. Maybe creating a relaxation room or corner. It was really interesting. I went on a tour yesterday to a new counseling agency here in Las Vegas, and they are going to be bringing in littles, little, like maybe from 5 to 8 years old, to run groups for social emotional regulation. And they had a little relaxation room, and where they had different textures. So like in the little room, they had like this thing on the wall. I'm looking behind me, like you could see it, but they had this thing on the wall that had like, there was like a carpet feel or a rubber feel. So very tactile, friendly. So they had weight blankets, they had beanbag chairs, so things where they can kind of physically, use that space to try to create some safety. Of course, the language we use, the tone that we use, the mood, so we certainly don't want to start off everybody's morning by being cranky and moody, and it's about time everybody sat down, but really try to set the stage. Another pillar is the idea of trustworthiness and transparency. So making and implementing decisions with the goal of building and maintaining trust amongst all of you and the families in the community. And so trying to be as open in communication. So sometimes I know, again, as a counselor, even when I worked for an agency, I would have the tendency to show up, go to my office, close the door, and just do my work. But then, when I did that, I was missing out on brainstorming ideas that some of the other counselors were doing. I didn't get a lot of support. So if I needed some ideas or I just needed emotional support, I wasn't accessing it. It took some time for me to get out of that office and acclimate, to integrate. So trying to be connected with your colleagues to share ideas, and also too with your families as best as you can. I know a lot of families are not as engaged as others, but hopefully those that might promote maybe some ideas and activities that you're doing in the classroom to the home environment, bringing in maybe some community members. So establishing relationships that promote that with the community. And then as far as classroom, making expectations clear. So part of that feeling of that trust and that safety, again, ties into consistency. I know what my teacher expects of me. So they're not going to get mad at me or be disappointed, or I know what to do. I know how to respond to the classroom because I know the expectations. I know what we're expected to do today. That's where, again, where that consistency and structure can be very helpful. Maintaining boundaries as best as you can, and then promoting that communication. Promoting peer support is another pillar. So again, we're talking about trauma-informed care, so we can take this framework into different settings. Thinking about it though, in the educational setting, what can we do to use for those that maybe have experienced some trauma, big T or little t, what can we do to promote safety, hope, and collaboration in the school setting? So maybe there's that idea of support groups or just after school groups, not necessarily to say, oh, this is just for those impacted by trauma, but maybe it's, it's a post-COVID-19, let's connect again. Or just encouraging a student to create a peer support group if they know others might be struggling. So just that idea of maybe opening up the school to ideas of activities, maybe working with your student body president or some of the other student council to come up with some ideas. To promote self-care and overall staff wellness. So that's for you all. So I saw you all talking during the break, so thinking like, how can we promote this so we have an enjoyable work environment? So maybe we as a staff have a once a month pizza day, or we as a staff check in with each other, or we do something, some sort of activity where we are each other's secret Santa or secret gift giver once every 3 months. So something that just promotes that self-care and overall staff wellness, to be able to maintain that positivity. And then of course, the idea of whenever there is a need to be able to connect yourself or your students to other types of resources. So whether that's handouts, whether that's brochures, whether that's a card from a local mental health agency, or maybe a psychiatrist. So just having those resources available and accessible can really be helpful. Collaboration. So recognizing that everyone has a role in creating a trauma-informed atmosphere. So work together, just like you're doing today. Hopefully there might be one or two takeaways that you can collaborate on, maybe with another educator, to say, why don't we partner up, and do something for our classes once a month, or let's bring in a guest speaker, or let's bring in, I know I have an 8th grader who can come into the 3rd grade class and talk about this. So trying to maybe do some sort of integrative work that can help just to build this type of culture. There's actually trauma care teams that are sometimes available and made available. So one of those examples is that as part of the practice, I am a coordinator with the child help program that's connected to St. John's University. And so being part of this trauma care team, I'm working with the team. So I joined the crisis team. So I attend monthly meetings with other educators, with parents, with administrators, with the social workers, therapists, and we all meet to try to see how can we work together. So if you need me to come in to do a trauma 101 for your parents, I can come in and do that. If say maybe a social worker wants to come and take a tour of the treatment agency, so then they know firsthand what it's like, what the process is like, what it looks like, where it is. So it's just those collaborative meetings can just really help promote that idea, and it helps us brainstorm. So now we're thinking about things like, how can we survey the kids? Like, how can we check in with them to make sure, what kind of screening tool can we use to make sure we're not overlooking any student? So now we have the principal on board, and our goal is to do some screening to see if some of these students might need some extra support down the road. So it's there, this can be accessible to you as well. And there might be some community resources out there too in the field. So maybe you joining a team, I know everybody's time is very limited, but just, yeah, maybe just checking out what other types of events. Sometimes they have 5K marathons. Sometimes they have, like yesterday, I went to that open house for a new community agency. And I walked away with good resources, brochures. I know what kind of insurance they take, and now I know somewhere I can refer a client for a higher level of care. So sometimes it's just nice to do some kind of community checking out. Empowerment and choice. So recognizing the uniqueness and individual differences and encouraging the use of strengths while giving individuals choice and control. And so again, another pillar of trauma-informed care is, even though we come in as educators and it's our responsibility to put together the syllabus and the structure and the curriculum and the activities, it's also, I know I also get some buy-in when I ask them, what are you interested in learning this semester? I'll get a gauge, because sometimes I work with students who are maybe a little bit more artistic in nature, some who love papers. Yes, I couldn't believe it. Sometimes like, no, I don't want to grade so many papers. Some who like to work in groups, some that like to have a partner. So I always just like to kind of get a gauge, because every class is different. And so when there's more investment, when there's more maybe just that collecting that feedback, and then we're able to reciprocate and respond to that feedback, oftentimes we're going to see that increased engagement. And what this does is it provides empowerment and choice. Little things that we can do. Sometimes, like with clients, like I've worked with many mandated clients who sometimes, actually, I used to go into the prisons and would come in and work with clients. And so sometimes, sometimes they really would feel a lack of choice or empowerment. But even if I said, would you like me to come back next Tuesday or Thursday? I'm giving them a choice. So Thursday, or would you prefer I come in the morning or the afternoon? So even in those little interactions, I try to do my best to promote empowerment and autonomy and choice, because it refrains from the one size fits all. It gives your students like a little bit of pride and confidence when they're able to share what they want, and it promotes healthy conversation as well. So and it promotes expression. Humility and responsiveness. So recognizing and addressing biases based on racial, ethnic, and cultural differences. And there's, of course, we have a whole workshop dedicated to this, a whole semester dedicated to this. Key piece, though, is the idea of practicing cultural humility. to recognize that we may not know, 100% about the different cultural backgrounds, that we might be serving. So it's really important for us to check our own biases, and to do our best to be an ally and an advocate as best as we can. So what can we do to do that? Well, we can review resources. We can attend webinars. In fact, last Friday, I went to a webinar that was put together by NADAC, which is an addiction counselors, but open to the public as well, that talked about working with our GBLTQIA adolescents, and how COVID-19 has impacted substance use increase. So I learned, again, terminology. I knew it really informed me of what to look for as a counselor in working with with the specific population. So doing what we can to just promote our own ongoing training, and having conversations, and just recognizing the idea of the humility that we certainly cannot learn everything, and it's okay, but we're doing our best. And so any questions? Actually, I think I want to stop here for questions. Any questions up to this point? Because the next segment talks about, what are some other strategies we can do in the classroom, but I also want to give a little space for any sort of questions or comments. I know it's kind of hard when you're at a table across the way. I don't know if I'm on a computer or TV screen. It might be a little tricky. So what we'll do is I have some time at the end. So if you maybe if you want to write your questions, or just save them for the end, or email them to me too, I'd be happy to respond to you, because I know it's a little tricky the way that we're set up here. So what I'm going to do is just talk a little bit then about some classroom activities, and then we'll take our next break. So, because again, I know with even me, it's funny because I used to attend 6-hour workshops on a regular basis, but I think even with the pandemic, my attention span has like really decreased. So it can really relate to some of our students coming back in. So that's why it's just, I know how important it is to take those little stretch breaks. So I appreciate everybody's patience with these workshops. So yeah, so if you have any questions, feel free to just jot them down, and or we can attend to them after, like when we wrap up, and or just I'll leave my email address. I'm certainly happy to help you out, and certainly can give you a copy of this PowerPoint as well. So what are some classroom management strategies? So these are some quick tips for promoting an emotionally corrective classroom. So we're going to talk about the idea of how your roadmap can, your classroom rules can serve as kind of your roadmap through navigating corrective emotion. The power of praise and positive teaching. So really, though, want to emphasize, though, the idea that in creating a corrective classroom, that you are the expert of your classroom. So anything I'm offering today is not to overshadow, to not overstep anything that you've already done, because you are the experienced one. You already have a vision for what your class will look like and feel like. My goal is just to maybe see if there's anything you could, again, sprinkle in and just supplement in what you're already doing, because you're great, your students best, and so you can serve them accordingly. In creating an emotional corrective classroom, we're really serving as a model. So just remembering that we have student eyes on us. Even me as a college student, I notice, I walk into the door and I eyes are on me. They're watching the way I set up my station. They're looking at my mood. They're looking at how am I going to start the day? If I'm flustered, because sometimes I'll come in and I'm running late and I'm flustered. So we really do want to do our best to model healthy emotional reactions. And even in those situations where I did come in flustered, we talked about transparency. So say, gosh, everybody, I hit a lot of traffic this morning. It might take me a moment to kind of catch my bearings. I'm just going to take a moment to breathe and sip some water, and then we're going to get started. So I don't, I try my best to be authentic. Like if I'm not having like a rainbow of a day. So just thinking about, because when we model healthy emotional reaction, even to negative things, it could serve as a really good corrective experience or learning opportunity for our students. So if students are used to seeing somebody, get mad quickly or maybe be very short, it can be confusing. So to say, wow, actually, we don't always have to yell or get mad if something doesn't go right. I know Mrs. Miranda didn't do that when she had a rough day. So leaving an impression. We're also modeling healthy problem solving because issues are going to come up. What if somebody spills something? What if you spill something? What if the computer isn't working? So it's just being very intentional, when we're modeling, when things don't go right, how to handle it. And then, of course, when it comes to corrective classroom, emotional corrective classroom is to know it's okay to use your supports. So if something comes up with one of your students, that just says, yeah, I think this needs a little extra attention that I can give right now, to know that it is totally okay, to use the supports within your school, the families, and your community, that that's completely, don't put all the pressure on yourself. So when we're talking about the roadmap, it's really important, to have that guidance. And I know that when I presented this part of this with another colleague not too long ago, and she had talked about like this metaphor of the using stop signs and speed signs to just give us guidance along the way. So if we didn't have those speed signs while we're driving down a highway, we probably could have the liberty to go, faster, probably past the speed limit. But when we see the 30, when we see the 45, it's kind of like a subconscious reminder to say, okay, let me stay back in my lane. Let me slow down. Let me think, oh, that's true. If I'm going 70, it's probably not the safest thing to do right now. And so this is really what those classroom rules hopefully provide for your students, that they serve as guidelines to just remind them, if things start to go awry, like, wait a second, there's that 30-mile-per-hour sign that reminds us all to kind of get back on track and slow down. So classroom rules, really serve as a structure. Sometimes, sometimes rules has a negative connotation. So maybe it's classroom guidelines, maybe it's classroom expectations, maybe, it's Mrs. Miranda's expectations, or it's room 45's expectations. So being creative with it, but making sure that everybody is on board and knows, what to expect. So laying out those expectations for the students. We have to remember that students learn differently. So maybe for some, it's writing things down so we can refer to them in a written form. Maybe it's talking about them because they learn more through verbal and audible communication. Maybe for some, it's just having them write things out. So just knowing to have everybody on the same page so they know what to expect and what the potential outcomes are if expectations are not met. Because this is going to help serve as the foundation of the classroom. Because I imagine some of you, when you first started out, maybe didn't have those ground rules in place. And so when things transpired, it was kind of hard to get everybody kind of back on track. because there weren't rules. So the students didn't know it was not okay to talk over other students, or they didn't know they had to get a pass to go to the restroom. So anything that you can think of and to be somewhat explicit in it is going to actually help them. So I feel more safe when I know what my classroom expectations are. And then this, of course, in that helps to create predictability and security. So rules actually give us like some of those students kind of like that cocoon of like, I know what to expect. I know Mrs. Brown is going to respond this way when Johnny responds this way. So there is less chaos, because sometimes our students, if they're coming from a traumatic background, are not going to operate well in a chaotic environment. Something that's semi-structured is going to feel safer for them. You know, not to say super rigid either. There's always room for some flexibility, because that's also modeling that in life that we sometimes have to be flexible. So some ongoing tips for classroom rules that, in saying all that, this is not to say that we want 25 rules, you know, for each class, but we want to kind of keep the rules to a minimum. So identifying like the really more important ones that that you can emphasize and reiterate. And maybe some can maybe be under the umbrella of another of a theme, like say respect. Like we are under respect. That means no talking over each other, no throwing papers, no talking over the teacher, you know, staying in our seats. So staying physically safe. I also like to use, as you notice, I try to use positive language. So if I, you know, I instead of saying, like I said, everybody must sit in their chairs, talk about like for safety reasons. For safety reasons, let's all stay safe, you know, in our assigned seats. So I really want to promote autonomy in a sense, but also like a strength-based language, so it doesn't sound so punitive. But we want to keep the words simple and age appropriate, so that all students know what the expectation is. And then that there's logical expectations for behavior. So we don't just set a rule just to set a rule. There's a reason behind the rule. It has to do with safety. It has to do with we have to manage time. There's because of our time management, our limited 50 minutes together, we really do have to stay focused and get this done within this time. So explaining, perhaps giving a little rationale to the rules. Keeping the words positive and specific. This is where we want to make sure we say like, all right, let's all, and nobody would say this, but just for the purpose of this, let's all be good kids today. It's like, well, what does good mean? So making it behaviorally like measurable. So what are the rules specifically? What does it look like? How would we define it? Make rules describe words that are observable and measurable, and make them visible if possible, so that students can be reminded of them. You know, sometimes we think like, oh, because we went through it the first day of school, that they should remember. But even working with college students, I have to go over the syllabus 3-4 times a year, a semester. Because what did she say again? Because the attention spans aren't the longest. So we really want to just remind our students of the expectations on a regular basis. So these are just a couple of examples. So we want our students to be responsible. But what does that look like? Because that's pretty darn vague. So instead of just saying, let's be responsible, everybody, we're going to follow directions the first time we're being asked. We're going to be in our seat when the bell rings. We're going to bring our materials to class. So if I told a student, all right, let's be responsible, what's responsible for me might be different for my neighbor. But everybody knows what it means to be in our seat when the bell rings. So, so that's where the specificity is so important. Being respectful. So what does that mean? Because if we told our kids just be respectful, they may not know what that is. Well, being respectful includes actively listening to others. Maybe not interrupting when others are speaking. Raising our hand and asking for permission to speak. That's being respectful for the teacher. So these are examples. Being safe. What does that look like? Well, this is where we're going to walk when we come in. We're not going to run through the door. And notice that we're emphasizing what we want them to do. So I'm not going to say, don't run. What do I want them to do instead? Walk when you come in the door. Walk slow, or just walk directly to your seat as we settle in. Keep your hands and feet to yourself. Follow those directions when asked. So really, we're like when we raise children, we don't want to say, you know, put your toys, don't dump all your toys. It's like, put the toys back in the box. We want to, the students are going to hear the direction. So emphasizing what we want them to do. And there's this idea of behavioral reciprocation. So the behavior you give out are the behaviors are likely to get back in the same form. So hopefully by emphasizing a more positive environment, so emphasizing what you're seeking from them, to using affirmations, to using those indicators of respect, ideally that's hopefully what will be reciprocated in return. You're modeling it, and students will, in time, may take some time, hopefully respond to it, age appropriately, of course. And yes, and then it is, and then a lot of it has to do on what we're bringing into the classroom. So a couple of terminology, and then we'll take our next break, is there's the idea of like positive reinforcement, negative reinforcement, and punishment. And this probably takes you all back to school when it came back to, okay, behavior. So these are all terms that are related to behavior. And the one that we really want to emphasize the most with trauma-informed care is the idea of positive reinforcement. So this is, we implement positive reinforcement when something, when it occurs when something is presented after appropriate behavior has been exhibited. So then that behavior increases. So for example, the earning stickers for completing a reading assignment. So the child or the student's going to associate something positive occurring after a delegated or desired behavior. So then I associate this behavior with like, wow, I received an affirmation, a sticker, some sort of reward. So it's going to encourage me to want to continue to do that. So for us, we respond to reinforcement. Sometimes we have our apps, right? And if we get certain stars, it like makes us want to do more. I mean, I get that Starbucks app and I'm like, I want more gold stars, so we respond well to positive reinforcements. Negative reinforcement occurs when students engage in a behavior to avoid or escape something, and then that behavior increases. So the example is student rushes to finish work, so does not get kept in from recess to complete it. So negative reinforcement doesn't necessarily mean bad. It just means that there's an escape or avoidance of a behavior when that to increase the desired behavior. So we really do, we want to focus more on the positive reinforcement. Punishment occurs when something that the student does not like or wishes to avoid is applied to that behavior that's occurred, resulting a decrease. So in that behavior. So the student skips school, they have to make up things, they have school detention. So that's, we're trying to decrease the skipping school by giving them the punishment, by giving them the detention, by giving them extra homework to try to extinguish the behavior of skipping school. And even though it can be effective, of course, and has its merits, it usually will leave more of a negative feeling among the students. And I'm not here to say delete punishment. Punishment should not exist. There's always a place for punishment. When there's an opportunity, though, is to lean more on the positive reinforcement before we get to the implementation of punishment, if possible. And just remembering when it comes time to be positive, to utilize positive reinforcements, is to be age appropriate. So going back to the sticker, our 11th graders probably not going to be not as happy if they get a sticker, like if they do something well or if they complete the assignment. So thinking about what those incentives look like and how to make them as age appropriate as possible. Appropriate to the level of functioning as well. So we don't want to set high expectations all the time, because then the student's just going to be disappointed, maybe feel let down, maybe doesn't feel like they're good enough. So it can actually contribute to more negative feelings. We want to avoid partial praise. So that's like, wow, yay, you were able to get your homework done on time this time around. So it's like, there's kind of like a kind of a sarcastic piece, or it starts off very positive, like, wow, everybody's in their seats right on time. It's about time. It kind of defeats the purpose of bringing in a positive reinforcement and praise and affirmation. So being mindful of those partial praises. That we want to make the most of the opportunities, that we try to bring in parental and administrative support as much as possible to try to sustain the positive behavior, the desired behavior that we're seeking. So if our desired, and to know what the desired behavior is for us, that's the tricky piece. Now, as a counselor, I have to come up with a treatment plan. And if I said, okay, the treatment plan is, I want Joey here to be happy, and that's on the treatment plan, that's going to be really hard to measure. That's hard for me to check on progress every week. That would be hard for me to use affirmations for. So I really want to delegate specific behaviors that are clear to me and clear to my students. So whether that's sitting in their chairs on time, actively listening during a certain part of the class, partaking in a class activity, but being very specific about what the behavior is, and then being very specific about what that positive reinforcement is, so that the students know, and that there's also a buy-in too. So we don't want to use a reinforcement that the students don't even care about, because then that kind of defeats the purpose. So making it sure, so maybe if it's a pizza party once a month, if everybody fulfills this something part of, they were part of that decision, that's going to create the motivation and reinforcement, I think. Okay, so I think we'll do this and then we'll take a break. So examples of other positive reinforcements in the classroom. It doesn't necessarily always have to be a pizza party. It can sometimes be a smile, like thumbs up. It's a nod. Those are positive reinforcements. Verbal praise. Thank you for participating. Excellent question. And we'll talk a little bit more about this when we come back. Tangible rewards, certainly within everybody's budget, of course. Sometimes those little things, I'm looking around here and I see just like little things I have stickers up here I've received from little things, or little badges or cards of appreciation, that somebody took the time to give me. Those things create a positive feeling. It's not the usual, 50-cent card. It's the feeling that one receives when they receive the tangible rewards. Sometimes activities can be rewards. Like if we can get this activity done, everybody gets that 5 minutes of free time at the end of the day or at the end of the class, or you watch a video at the end of the day. So something that's more of activity driven. And then of course there could be a group reward, like we talked about, a monthly ice cream party or a comic book party or something that just creates positivity and group motivation. So thinking about group motivation, this is a good time to take our group stretch. We're almost approaching the 10 o'clock hour. So when we come back at 10, we'll be in our home stretch. So thank you everyone for paying attention, and I'll see you back here at 10 o'clock. Our third hour. All right, home stretch. All right, share my screen. All right. So just to recap what we were just talking about, we're just talking about positive reinforcements in the classroom and just all the little things that we can do to help promote the desired behavior. Just a couple of some things to add. What I wanted to add to the verbal reinforcement, because we were talking here about that verbal praise. You know, again, the feelings behind tangible rewards, activity rewards, incentives, group rewards. When we do use verbal praise, it's really nice if we're able to be specific about the desired behavior when we choose to give back verbal reinforcements. So instead of like saying like, oh, well done, I mean, which is still good, you know, still like if you're going to say anything, say something, you know, positive, that's fine. What's sometimes more meaningful though, is when we can be even more specific. Like you demonstrated such creativity by adding such bold colors with this art piece. When students, or most of us, hear the specificity of that verbal reinforcement, you know, it can really be meaningful. So not to dismiss the well done, good jobs, you know, because those are important too. But when we see an opportunity to give that specific feedback, and it's not easy because as a therapist, I strive to do this with my clients to say like, wow, you've demonstrated such progress by accomplishing your journal entries and by practicing better communication skills. Yeah, so it takes practice, but when we do, it really feels good for the students. And another thing I do, one of my little tricks, I guess, tips as a counselor, is that when I practice affirmations with my clients, maybe a takeaway for you is that I really strive to start with using the term you or your. So you demonstrated creativity by adding bold colors. You created this art piece from your imagination that is just impressive. Your art, your creativity, your art skills, your writing skills, how you really improved over the last month. It sounds a little bit different versus I think. So again, I'm going to use those same terms. I think you demonstrated such creativity by adding such bold colors. I think, I feel that your writing has improved. So even though both meaningful, there's something that conveys more of an intrinsic message when we use the word you. You are an amazing instructor. You are dedicated by being here at this workshop today. You are a lively group, you know, as demonstrated by so much laughter. Can really be conveyed more meaningful than if I said, I, Roberta, think that you are a lively group. There's something about hearing you or your that just helps to automatically help that affirmation feel a little bit more personal and internalized. So I encourage you to even try this with your loved ones when they come in to say, oh, you made an amazing dinner tonight. See how your family responds to it and see if you see any difference. When using verbal reinforcements, it's also best to try to practice immediacy. So the sooner that you see that behavior and the sooner that you can convey that reinforcement, there's a high likelihood for that behavior to increase versus, you know, saying it at the end of the week or at the end of the day. So if possible, to be able to practice immediacy, and even to the group. So when we're using verbal reinforcements, it doesn't necessarily have to be for that one student. It could be, wow, I mean, the students really like sat in their seats, they paid attention, they did exactly what you had hoped for them to do. Practice that immediately with the verbal reinforcement with the group if possible. And of course, in all of these examples, to be genuine, students are very intuitive and they can sense authenticity. So when we give an affirmation and maybe on a personal level, not impressed with the big project. We want to convey maybe something else. Like you conveyed such determination, when you put together this project. But we really want to make sure that we're genuine when we're giving that verbal feedback. So some foundations of positive teaching. We really want to, if we were going to break it down in ratios, is to use as 4 positive statements or actions for every negative. So we want to be mindful that our feedback, our statements, or affirmations really outnumber some of the negative things that we may have to talk about, if possible. And I really strive to try to even use the negative feedback or the consequence or maybe like, just what I need to convey as strength-based as possible. But it's not always easy, but to really try to keep those statements as positive as if we can. Foundations of positive teaching include trying to do our best to build positive relationships with the students. You know your students best. So whatever that might look like, age appropriately. So whether that's, do I build the relationship by creating icebreakers, by working with them one-on-one, by having maybe more family-focused meetings. So whatever that might look like for you and your students. Maybe coming up with some sort of activity in the beginning of the semester, mid-semester, end of the semester, to help build upon that. To give accurate, specific, descriptive feedback like we talked about, and even acknowledging efforts is important. So maybe if they didn't get all their assignments done at the end of the week, we want to acknowledge what they did well and not what they missed necessarily. We don't have to be super lengthy with our feedback either. We can just create, again, that immediacy and say something that's just, we don't want to put that extra pressure on ourselves. Explaining the rules ahead of time so students know what to expect in the assignments, the class expectations, the projects, with that consistency that we talked about. And then also making sure that we do our best to communicate with parents about the positive things their students do. Sometimes when we think about like parent-teacher conferences, sometimes if a child has been maybe a little bit more active in the class, so we're going to focus on like, oh gosh, Bobby really gets out of his chair a lot. We also want to, in that, convey what we also see them doing well, making progress on. So. And then at the same time, to give yourself self-praise too. So giving yourself kudos to know that what these efforts really do require energy, require creativity, require patience, require resources. So everybody in this room, deserves kudos for all the work that you're doing, and to just give yourself that praise. So at the end of the day, instead of focusing on what went wrong, maybe focusing on what went well. Focusing on what can, this activity, deserves a gold star. And so what can I do to build upon this activity? Because, and obviously this is something I work on myself. I will, after my class leaves, I will sit there sometimes for a moment to say, ooh, wow, that was not what I expected how I expected it to go. And I have a tendency to kind of beat myself up for it. And I'm trying even to this day to like say, all right, that maybe that discussion didn't pan out as I expected. However, students did walk away with this resource, and this student really felt heard. And this student really felt like got some good questions answered for her career. So trying to remember the positive things about those classrooms, the classroom experience. So this helps us segue into the last section, which is still a very important section, because when it comes to trauma-informed culture and care, one of the biggest pieces is for us to take care of ourselves. When we're exposed to a lot of student experiences, when we hear a lot of personal stories from our students, when we see things, that maybe can be disheartening. If we see the student not eating, if we see the student with the same clothes every day, it could really hurt our hearts. It could really impact us on a personal level and really bring that energy down and create fatigue, create compassion fatigue, create burnout. And that's what we don't want. So that's why we don't want to avoid the conversations about trauma, but at the same time, we have to make sure to maintain a balance, to make sure that we have the strength, the resiliency to be attentive and have a heightened awareness for this. And so I'm going to spend some quality time talking about this because it's really important for us to set the stage. Part of a trauma-informed culture is good emotional health for ourselves. And the term that we probably are very familiar with is the idea of self-care. So we probably see this on social media. We see this in just little, it's kind of become a colloquial term, but sometimes there's a confusion about what self-care is. And so hopefully by talking about it, you can set the stage for yourself as you really enter a new school year to perhaps start implementing some of these self-care practices to really maintain that resilience. So self-care, I love this poster because sometimes we think like self-care is like the occasional bubble bath, or getting an ice cream or treating ourselves to a new outfit. And those are definitely rewards for ourselves and definitely should be practiced. However, when we think about self-care, what we really want to promote is the idea of something that's more part of your routine, that creates more consistency, that creates emotional safety, the emotional well-being. So self-care is actually, endeavors such as setting boundaries with others, saying no to not overextend yourself, setting boundaries to not overwork yourself, for example. Self-care is actually asking for what you need, reaching out, leaning on others, taking a break when you need to take a break regularly, not just once in a while. Perhaps therapy to monitor just our own emotional regulation, physical well-being, such as getting a full night's sleep. So self-care is not an indulgence. It's not selfish. But sometimes we think, gosh, if I take an hour for myself every day, an hour, that's being selfish. It's actually the opposite. That time to yourself is actually going to give you more energy and more presence in the other work that you're doing. Self-care is not a one-time experience. This is something that we really need to incorporate on a day-to-day basis. Self-care does not need to be time-consuming. So if you can't set aside an hour, what is it you can take some time aside to do? It's important to set out some time in your day for self-care. So we want to just ensure that it's part of your routine, that it helps us to get centered, so it grounds us, because we can just be in our heads, driving from A to B, thinking about what's for dinner. Now what I gotta prep for tomorrow's curriculum. And it's just all of a sudden, it's just a whirlwind and another day goes by. And then what happens when we do that day after day after day after day, we start to feel fatigue. We start to feel burnout. What is burnout? Burnout is when I start to feel like I don't like my job anymore. When I start feeling a little cynical. When I start to feel like I'm exhausted. When I want to maybe engage in other behaviors on the weekend that aren't the healthiest to kind of make up for the work week. So there's just, it's really important because self-care is preventative and it helps us keep our mind, body, and spirit connection thriving. It helps us to manage personal triggers. If we ourselves gone through some big T and little t, and we work with a student that might resemble something we've gone through, we might experience a little bit of an emotional trigger. And the key piece is that it's okay to acknowledge it. It's to recognize it, like I'm feeling really emotional or specifically sensitive to this topic. And what can I do to manage this? So maybe I need to journal, maybe I need to talk to somebody, maybe I need to refer the situation to a colleague or to a professional. So that self-awareness is what's key here. We talked about the potential burnout if we don't take care of ourselves. Helps us to maintain and love the work we do. You know, I've like I said, I've been in my, if I were thinking about my mental health program at UNLV, I've pretty much been in the mental health field since 2002, since 2003, so about 20 years. And I still love what I do. Even though I teach and do other supervision, I still have a private practice. I still run groups with my students. I still love doing therapy. And I wouldn't be able to do this over 20 years, given what I hear on a regular basis, if I didn't practice self-care. And I'm still to say, I love my work. It helps me to stay present. And it's a good modeling for not just your students, but for your family members, for your loved ones, to set time aside to say, I want to go to the gym 3 times a week. That is my time. Or I want to just do some meditative work in my office for 15 minutes every morning. Or I'm going to make sure I take time to cook a little something for myself. Whatever that is for you, that's what you're going to model to others. So let's just talk about ideas. So if you're perhaps maybe back there thinking, well, what the heck do I do for self-care? Or what can I do for self-care? These are just some ideas I put together that can maybe be there as you start. I just think starting the new semester, if you're already implementing some of these self-care activities, then to continue incorporating them. Maybe some of these areas could use an inch of improvement to see what can I use, what can I do to maximize this so I feel good. One of those important areas is the physical self-care. Are you getting enough sleep? Most of us are not. And I actually worked in a sleep lab as a polysonography technician when I was going through grad school. So I put like the wires on individuals, patients coming to the hospital to see if they had sleep apnea, see what their sleep cycle was like. And in that, I worked graveyard. So kind of in a paradoxical way, I was very sleep deprived. So I learned firsthand the importance of sleep, because not getting enough sleep really did impact my mental health. I became depressed. I gained about 20 pounds. I was irritable. I was not creative. It was a pretty rough time. So there I was working with people with sleep disorders, and I myself developed some poor sleep habits. So just recognizing, what can I do to incorporate sleep, because it just manages so much of our well-being, our emotional and our physical well-being. So does that mean maybe trying to limit some of the screen time a little earlier in the day, trying to incorporate some boundaries? That's where the boundaries step in, something to really emphasize and prioritize sleep, because it's related just to such so many parts of our well-being. Watching our diets, of course, staying as active as we can, even if that's going for a 10-minute walk every day, something that moves the body, that's just going to help us get out of our chairs. Most of us, if we are at home, we're sitting in our offices, we're sitting on our computers. So stretching, moving, whatever, we can do that on a regular basis. Practicing social self-care. Going back to what Brene Brown was saying, is that connection is so important for our emotional well-being. So figuring out ways that we spend quality time. So quantity over quality. So we might be in the same room with our loved ones, but are we spending that quality time engaging in conversations, getting your emotional needs met, nourishing those personal relationships with friends and family, with ourselves, really, too. Excuse me. Mental health self-care. So this is really important, too, because there's a lot of energy that you spend creating the classroom. So there's a lot of emotional and mental work and cognitive work you put into developing curriculums, activities, managing the classroom, there's a lot that's entailed there. So if we don't give ourselves some mental self-care breaks, it could really be exhausting. So thinking about what can I do to activate, to mentally stimulate me on a personal level, creatively? What can I possibly set some boundaries on so I have that mental, that cognitive break? What do I do that's maybe enjoyable or creative or just gives me another cognitive or mental health outlet? Because oftentimes I know for myself, if I'm like preparing for a workshop and then going into supervision and then preparing for a class, I don't get a break. And then things become a little stagnant. It's when I take the break, go for the walk, or do something that's unrelated that I get the most ideas. So figuring out how to incorporate that for ourselves. Spiritual self-care. Gratitude. There's a lot of support, that recognizes the practice of gratitude does help improve satisfaction levels and feelings of positivity. So when we have our roughest days, thinking, oh my gosh, this is a rough day, is to maybe reflect back on it to say, okay, I recognize maybe it was a rougher day, but what am I grateful for at the end of the day? I was able to connect with all of you and be able to hopefully provide some takeaways. I was able to have a good conversation with my significant other. I was able to, so trying to practice, like, what are those little moments in the day that were actually positive that I can express gratitude for? And then just in figuring ways just to connect with ourselves in more of a reflective manner. So whether that's journaling, whether that's sitting in silence for a moment, maybe that's driving in your car and listening to your favorite music. So whatever you can do to just connect with yourself, giving that time aside for yourself can contribute to that spiritual self-care. And then also connecting, we have got our spiritual and we've got our emotional self-care too. So how do you process the emotions? So thinking about what works for you. And the key term is healthy, because again, if we bottle up our emotions, then there could be explosions. There could be, I just want to party on the weekends. I'm just going to stifle this and I'll deal with it later. It's like, that's not the healthiest way to process emotions. So in that part of that self-care routine is figuring out, okay, if I feel, like maybe overwhelmed at the end of my school day, that's when I recognize maybe I need to incorporate something regularly that's going to help me manage my emotions. So maybe I know at 3 o'clock, I really need to pencil in for myself. I watch a YouTube video that makes me smile, or I call a family member, or I go for a drive or go for a walk, or I plan a yoga class. So knowing yourself and your routine can be so helpful. Yesterday, I was feeling crabby. I don't know what it was. It was like Monday come 5 o'clock. And I was thinking, I don't know what the heck. I'm just like feeling just in a bad mood. And so I said, you know what always helps me is just going for a 30-minute walk. And that's even though I didn't want to. And I swear I felt 75% better after that walk, because I just was able to, I put on my headphones and I was able to check out. And then afterwards, I had the rest of the evening to feel more productive, to be in a better mood. And, it was my own intervention, that worked for me. So figuring out ways to get you recharged, reset, that helps you. And then knowing that this is your formula. So as a therapist, I'm not here to say, okay, do a 30-minute walk, eat broccoli, do yoga 3 times a week. That may not work for everybody. You know what works for you. The important part is putting together a plan, to not just say like, yeah, I should do this, or I know my friends do this, and that takes too much time, too much effort. I don't have the time to do this. Is to really perhaps being intentional to think like, and know that new habits take time to form. And it's okay. You have to practice hiccups. One of my goals was to practice. I have a little gratitude journal that I got at the beginning of the year. And I could say I was pretty regular from January through like April, then May waned off, June kind of coming back. Yesterday I said, you know what? I want to be back on track. So I'm like going to be consistent on August, but I'm not punishing myself for missing out some entries in April and May. It just knows that sometimes it just takes time for these habits to become part of our regular routine. So being flexible, but then doing our best to come back to say, you know what, I can come back and do this. Because when I was doing it, I would feel good at the end of the day, thinking about what I was grateful for at the end of the night. So knowing what works for you and figuring out now that you're going to be coming back to the school year is what can I do with my mornings if I have to be up earlier, if I have to go to bed earlier, what can I do throughout the day that can be self-care related? So I'm not going to read out all of these. This is there was this little workshop that I helped out with that talked about happiness. And so I just put some other things just to think about when you're trying to create a positive space for yourself. And some of those things, are related to surrounding yourself by maybe some an environment that's organized and maybe has some nature, a plant, some colors, perspective taking, seeing things as half empty, half full as full as versus half empty. And just being able to let go. So just some of these are just some ideas to how to incorporate meaningful activities into your self-care routine. So as we start to wrap up, and I know we're going to wrap up a little earlier because I had left a few room for questions, but I did want to start to transition back to the role of what you all do. And this is another Brene Brown. This time it's a quote. And she says, teachers, we can't always ask our students to take off the armor at home or even on their way to school because their emotional and physical safety may require self-protection. But what we can do is create a space in our schools and classrooms where all students can walk in and for that day or hour, take off the crushing weight of their armor, hang it on the rack, and open their hearts to truly being seen. We should never underestimate the benefit to a child of having a place to belong. It can and often does change the trajectory of their life. And in saying this is to really highlight just the amazing work you do, because it can sometimes feel daunting. It can hopefully feel rewarding. It can sometimes feel underappreciated. But just, taking this quote and hopefully taking it to heart to know that you can create the space that can really change a student's life. And this comes from Brene Brown's book, Dare to Lead. So in that, as we start to just actually wrap up a tad early, I wanted just to share with you all just some amazing resources out there. There's the Tough Kid book, there's the New Teacher book, a free resource that is available to all of you is the Skills for Psychological Recovery. And I put the link there on the bottom. So it's a free PDF. And what it does is it just gives you some additional skill sets. So if you wanted to take this trauma-informed care culture just even a little bit deeper, this isn't mental health therapy or anything like that, but sometimes it might provide you with the dialogue. So sometimes I know as new helpers, we get a little stunted, like, I don't know how to ask the client if they're feeling suicidal, or I don't know if I should ask this. And this curriculum gives you that framework, that helps you, anybody at any level, especially in this, in the helping educational realm, to feel more confident in having these types of skill sets and conversations. So it's almost like that preventative, not preventative, but little less like next in an intervention opportunity, and then helps to screen those students that maybe need a little bit more work after having a dialogue. We know that mental health providers are so limited. So if we just depended on mental health providers to fill in these gaps, it is just not enough. So if we can work together to have these conversations with students, then we're going to see just better outcomes. The trauma-informed care, there's resource centers, the National Child Traumatic Stress Network there on the bottom. I encourage you all to check it out. It's going to give you some other just great resources. And that is what I have. So that's my email there on the bottom. So feel free to email me, connect with me if you have any questions or thoughts, or just have any questions about our CIS program. I can connect you, and any questions.
Yeah, and what I do is I can stay around, Roberta, and anybody who wants to stay and ask questions, I can help facilitate that. And everybody else can be free to go. But thank you for your continued support of our kids in Humboldt County. We certainly can't do it without you guys. And I know, speaking from being a secondary administrator, that it's an invaluable service for our kids. And I know I certainly couldn't have managed the school without you guys' support. So thank you very much. And yeah, anybody who wants to ask individual questions.
Sounds great. Thank you so much. I appreciate everybody's attention, and good luck with the new school year, everybody. Thank you.